MobBuster72 here again. Today we're going to talk about first aid, medicine, and hygiene during an emergency event, all the way up through a W.R.O.L, a without rule of law type of situation. During most major emergencies, medical services are going to be overwhelmed. And if we end up with a W.R.O.L type event, they may be non-existent. I in no way consider myself to be a medical expert. I have been in the military for 21 years now, and every year we have to take first aid as well as CPR. So at the end of this video, I'm going to give you a couple of references. I want you to go and look up these people's channels. They definitely have more expertise in this field than I do, and you should definitely give that a look. We're going to talk about different lengths of events. We're going to talk about short-term, intermediate term, and long-term. Let's talk about short-term first. These are events that last anywhere from 1 to 7 days. A short emergency. And this is the most likely to happen. The most important medical thing that you can do is get an education. Learn about first aid, take a CPR class, learn how to do these things. This is much more important than any equipment you could ever have. That said, every person should have a first aid kit in their bug out bag. Yes, you need the day-to-day items, the band-aids, things like that. But you also need some of the more in-depth things to treat trauma injuries. These are going to be bandages, tape, gauze, and things like that. I would also suggest epinephrine pens. Especially if you're allergic to, say, bee stings or things like that, you need to have that. But even if you're not, it's also a good idea. I think it goes without saying that if you have medications that you have to take on a daily basis, you need to make sure you have a supply of those. I think you also need an assortment of over-the-counter medications. Things like pain reliever, maybe some allergy medication, cold and flu medication, and something for diarrhea. Now be careful with that because you also don't want to have the opposite effect. Now let's talk about hygiene also. Hygiene is something that it's actually easy to neglect. Being deployed all the time, sometimes it's hard to take a shower every day. Sometimes it's hard to take a shower every week. It'll help keep you healthy, and it actually is a good morale booster too. If you're unable to get to a shower and wash, there's still some things that you can do to help with your hygiene situation. Make sure you wash your hands and feet, your face, and your sweaty areas, your pits and your crotch and, well, your backside too. Now, that may not be the exact order you should do it in, but I would definitely suggest you do your face first. And the best thing you can use for that is to have some baby wipes in your bug-out bag as well. Also, toilet paper, soap, toothpaste, and a toothbrush. Most places you're going to have to worry about mosquitoes at least part of the year, so don't forget the DEET. Now, intermediate events are those that last anywhere from 7 to 90 days. For this type of event, you're going to need basically more of all the same things. You're going to need more of those hygiene items, more of those medication items, and you're going to have some place to store them. I would suggest adding a few other things like shampoo, maybe razors and shaving cream, and definitely a lice or critter shampoo, as well as maybe some antibiotics. And for those bugs, maybe now is when you need to be thinking about things like permethrin. This is a treatment that you put on your clothes, you let it dry, and it will actually keep bugs away even better than DEET does. And you can wash your clothes and it's still effective. For long-term events, these are events that last anywhere from 90 to 365 plus days. This is when things have really gone bad. Now it's possible to have a large quantity of medical supplies and hygiene supplies that will last you a year, even maybe 2 years. But the most important thing you can do, again, is educate yourself. Learn how to make some soap. Learn how to make those type of things. Learn what plants have medicinal values to them. I would also suggest possibly having a surgical kit. Now I know there's a lot of people out there who say don't have one because you'd just be tempted to use it. I think that you could learn to do some minor stitching, nothing life-threatening, but if you're able to meet up with somebody who happens to be a doctor or a surgeon, you will have the equipment that they may need. Now I know that medical and first aid for an emergency, this can be daunting. It really can. It's hard to know where to start for most of us. And here's where I'm going to tell you those channels that you can go look at to get some more information. So there's 2 channels I really like as far as medical and first aid goes, especially when we're talking about preparing for an emergency. And those channels, I'm going to put some links up here, but those channels are Skinny Medic. He's got some good stuff. He actually also has a site where he sells first aid kits and things like that, so check him out. And the other one is the Patriot Nurse, and she goes around to different places and does some training. I haven't ever been to any of her training classes, but her videos are very good. So take a look at them. They're definitely better at this medical thing than I am. So go check out their channels. Let them know I sent you. Next time we're going to talk about your shelter needs during an emergency. Until then, take care and be safe.